So this is Dr Mary Doherty, and she earned her MBBS degree from University College Dublin and is a consultant anaesthetist. She's always been autistic, but she was only diagnosed in her mid-40s after her son was diagnosed, and this allowed her to find some answers regarding some of the struggles in her life. Ever since then, she's been very outspoken about the challenges of being autistic in her line of work and has started Autistic Doctors International, an online support group which has reached doctors in Europe, North America and Australia in 2 years. So I will hand over now to Mary. So if you have any questions, just pop them in the chat and we'll make sure to read them out at the end. So thank you.
Great, thank you for that. Thanks for the introduction. I'm delighted to be taking part in such a fabulous event and hopefully to start a conversation about a topic that's been something of a taboo subject in medicine, I think until recently. But first I want to say just how much I learned today. David Nutt's talk was eye-opening. Jock's talk resonates deeply with me because my research area is the barriers to healthcare for autistic people. And I love Joanna's talk because we know that there's a significant overlap between the autistic and LGBT plus communities. Ahmed's talk brought me to tears. Those of you who know me from Twitter, who follow me on Twitter, will know that the conflict in Gaza has been on my mind quite a lot the past few weeks because I visited the occupied Palestinian territories in 2019, saw for myself the occupation, the apartheid, and the dehumanization of the Palestinian people. And it's just so important for us to be able to have these conversations about systemic bias and racism in healthcare. And I've been working in the area of autism advocacy for a number of years. And the more I talk about this, the more I realize that neurodiversity is an issue that's relevant to all of us in healthcare. We all encounter neurodivergent patients. Many of us have neurodivergent kids. Some of us are neurodivergent ourselves. And we're used to thinking of diversity in terms of race, ethnicity, and of course, gender and sexuality. But we need to add neurodiversity to that conversation. I'm going to talk a little bit about my story, as well as neurodiversity, what it is, what it means in practice, the strengths and challenges of being autistic in medicine, how to recognize and support autistic colleagues, and some of the reasonable adjustments that make life easier for all of us. I have 3 take-home messages. The first and the most important is that the negative framing of autism perpetuates the stigma that is so pervasive both in society and particularly in healthcare. And this negatively impacts the mental health of autistic people. Secondly, autism is incredibly heterogeneous. Autistic professionals exist in all fields, and autistic doctors and med students are a hidden minority in medicine. Thirdly, supports for autistic people cost little. Understanding is the primary need, and reframing of our view of autism will save lives. Autistic Doctors International is a peer support and advocacy organisation founded by me 2 years ago. And we have a linked group for autistic med students. And while some of you will already know or suspect that you're autistic, for others that light bulb moment may happen as you listen. And if so, you're not alone. There's loads of us in all branches of medicine, and we're a friendly and supportive bunch. So if this talk resonates, get in touch, come join us, because finally finding our true peers has been incredibly positive. That was an article I wrote on neurodiversity, which was published in the Anesthesia News last December. And a lot of what I'll touch on today is dealt with there in more depth, particularly the practical aspects of supporting neurodivergent colleagues. And although neurodivergent conditions include ADHD, dyslexia, and dyspraxia, among others, my work focuses mostly on autism, so I'll be talking mostly about autistic people. Some of you will recognize me from Twitter, where I tweet as the Autistic Doctor. And 8 years ago, after I'd given up work to care for my child around the time of his autism diagnosis, I was also diagnosed as autistic. And I'll be honest, I was terrified for my career at the time. Can you be autistic and work as a doctor? I had no idea. Now I know, yes, of course you can. And I also know that there are loads of us. So I work in a small hospital in Ireland, doing mostly anaesthesia for general and orthopaedic surgery, but it's my other job. I'm a qualified ski instructor, and it's me teaching in Andorra a couple of years back. And in normal times, I spend my winter weekends teaching on the dry slope at the Ski Club of Ireland. And I'll tell you, I'm missing the snow this year. But let me show you the Munchkin. If I can get, yeah, if I can get the slides to work. That's the Munchkin. He's now 13. And the thing is, obviously, I've always been autistic, but I had no idea until he was diagnosed in 2013. And suddenly everything made sense. Now, his diagnosis at 6 was late given his presentation, but that was in part because I didn't see anything particularly odd about what were in hindsight really obvious autistic traits. And then my own diagnosis followed a few months later, and it finally explained a lifetime of personal and professional difficulties. I'm still baffled. How on earth did I get to be a consultant anaesthetist in my mid-40s before anyone noticed, including, it must be said, several psychiatrists who I'd seen over the years. But of course, there was little known about autism back then, and particularly for women. But it's not as if it wasn't obvious if anyone had known what to look for. Thankfully, awareness is growing, and we now have community initiatives to raise awareness and understanding, such as autism-friendly town projects in Ireland, and Dublin City University is the world's first autism-friendly university. And we also have specific awareness-raising campaigns within medicine, such as autism-friendly hospital projects in several Irish hospitals in conjunction with As I Am, our national autism charity. And in the UK, there's the fabulous NHS Different Not Less campaign, which was started in Kent and Medway, which I'd love to see rolled out nationwide. But what is neurodiversity? It's a term coined by Australian sociologist Judy Singer in 1998. It was inspired by the concept of biodiversity and relates to the diversity in neurocognitive functioning. And as we all recognize that biodiversity is essential for a healthy ecosystem and a healthy planet, similarly, there's increasing recognition that neurodiversity is beneficial for humanity. The neurodiversity paradigm suggests that individual variations in neurocognitive functioning are part of the natural range of human diversity, and that neurodevelopmental conditions such as autism, dyslexia, dyspraxia, and ADHD are neurological differences rather than inherently pathological. The social model of disability frames the associated challenges as situated in a society not adapted to our needs, in contrast to the traditional medical model of disability, which is predominantly deficit-based. Now, the terminology can be a bit confusing. Neurodiversity is a feature of populations, so the term for an individual should be neurodivergent. And as biodiversity relates to a species, and you don't call an individual animal biodiverse. So similarly, you shouldn't call an individual person neurodiverse. And I digress. We could talk about language all day, but language matters though. And this is from the March issue of the Australian Journal of General Practice, which had a focus on neurodiversity, and it's available open access. Highly recommended. And also look out for a letter in response to this by myself and colleagues from the Royal Colleges of Psychiatry and General Practice, which links the negative framing of autism to adverse mental health outcomes. And hopefully that's due for publication soon. But generally, autistic people prefer to be called autistic rather than the person-first language that's preferred for other conditions. Person with autism or doctor with autism feeds into the stereotype that autism is some sort of a tragedy separate from ourselves. But when you flip it around and view it from a neurodiversity perspective and recognize all the benefits that autistic people bring to the world, then it's easier to see the reality that autism is a core feature of our identity. And that's important because of the prevalence of mental health problems in the autistic community. Increased suicide rates, and up to 80% experiencing significant anxiety and depression. We know that developing a positive self-identity is protective, so it's important to fight the stigma that surrounds autism, and that starts with language. Autism, it's a neurodevelopmental condition. It's not a mental illness, although it is associated, as I mentioned, with high rates of co-occurring mental health conditions. It is a social disability, involving communication differences, sensory sensitivities, focused interests, and preference for routine. One of the most heterogeneous conditions in terms of presentation, with a broad constellation of strengths, abilities, and support needs. And for current thinking around adult autism, I'd recommend the Royal College of Psychiatrists report CR228, which I'm pleased to have contributed to. Let's look at some of the positive role models who clearly demonstrate the strengths associated with autism. Greta Thunberg, of course, needs no introduction, but there's also Anthony Hopkins, Daryl Hannah, Chris Packham, Alan Gardner, the autistic gardener from Channel 4, who's got a fascinating story from a medical perspective. Also Susan Boyle, Anne Hegarty on I'm a Celebrity, all shining a spotlight on autism in the mainstream media. We've countless examples in history. Unstoppable Brilliance by Professor Michael Fitzgerald, an Irish psychiatrist. He looks at famous Irish historical figures who may have been autistic. Now, it's important to state we can't make a diagnosis of autism or what was formerly Asperger's syndrome posthumously, of course, but autistic traits are pretty easy to recognize in biographical or autobiographical writings once you know what to look for. In science, we have Albert Einstein, Charles Darwin, Alan Turing, Marie Curie. My favorite is Dr. Robert Spitzer. I first heard of him when I read Neurotypes by Steve Silberman. He was primarily responsible for the removal of homosexuality from the DSM-2 in 1973, which was the result of his single-minded and almost single-handed crusade to eliminate the psychiatric stigmatization of difference. His other major accomplishment was to save psychiatry from a crisis of credibility by systematically developing the DSM-3 and its subsequent revision. This is the man who's been credited with saving psychiatry itself from extinction. He doesn't understand people's emotions. He knows he doesn't, but that's actually helpful in labeling symptoms. It provides less noise. That was a quote from well-known psychiatrist and chair of the DSM-4 task force, Alan Francis, who also called Spitzer an idiot savant to diagnosis. To quote Steve Silberman, while Spitzer's eccentricities may have fallen short of meeting the criteria for Asperger's, the DSM-3 was the product of a mind that exhibited many classic qualities of autistic intelligence. Wouldn't it be the most supreme irony if the man who created the Bible on which modern psychiatry is based was one who thought like us? And what more evidence could we need that diversity of thought within medicine is vital and that we need to recognize and celebrate neurodiversity? The concept of a condition, once considered pathological before being recognized as a form of diversity, has echoes in the gay rights movement. And sometimes when I talk about being an autistic doctor, I think about Dr. H. Anonymous, who was later identified as Johnny Fryer, addressing the 1972 American Psychiatric Association Convention, when he stood up on behalf of what they termed the gay PA, wearing a mask and using a voice-distorting microphone, and said, "I am homosexual. I am a psychiatrist." That was when homosexuality was not only considered a disorder, it was criminal. And look at the difference in societal attitudes over a generation or two. We need a similar paradigm shift in terms of how we look at autism. And the thing is, medicine selects for autistic traits. Lots of us actually meet the criteria for diagnosis. All is good until demands exceed the capacity to cope, and then the wheels fall off. My belief is that autism should be specifically considered when doctors present in difficulty. Now that tweet's a bit old. I don't use ASPE or ASD anymore. I prefer condition to disorder, and mostly I just use autism. Science and academia also select for autism, and yet, due to the current stigma around the condition, most of us remain in hiding. I hope that we can change that culture so that it's possible to come out as an autistic scientist, doctor, academic, and have our contributions valued without fear of negative career impacts. We know a little of the prevalence of autism amongst doctors, but it's more common than we might think. So there's talk in the autism field of this lost generation of autistic adults who weren't picked up earlier because autism often wasn't recognized, and particularly in women. For all neurodivergent conditions, estimates of prevalence are up to 15%. The general population rate for autism is 1 to 2%. Now, I think it's even higher in medicine. We know that there's an association between autistic kids and parents in healthcare, with autistic kids being up to 6 times more likely to have parents in healthcare compared to other occupations. When we look at GPs, one study showed 1% of GP respondents disclosed that they were autistic themselves. We know of at least 18 cases where an autistic spectrum condition was identified in GMC fitness to practice proceedings, and there may be many more. 56 doctors have declared the condition to the GMC, although there isn't a requirement to do so. And Autistic Doctors International and Autistic Med students, we currently number well over 400 members. We've got a wide range of specialties in ADI and listed here in order of prevalence. And as you can see, psychiatry is second only to general practice, Now, when we think about the relative numbers of GPs and psychiatrists, it may well be that psychiatrists are overrepresented amongst autistic doctors. We share common challenges, particularly around anxiety, transitions, communication, sensory issues, and difficulties accessing supports. My career prior to diagnosis was anything but seamless. My undergraduate years, postgraduate training was spent lurching from one crisis to another, and in hindsight, mostly due to unrecognised autism. Throughout my clinical years, I was fine with patients, but struggled with peers. And I'm not for a moment denying the heterogeneity of presentation or the serious disability associated with autism, but when we're talking about autistic doctors or med students, we're looking at a group of highly intelligent, high-achieving individuals who nonetheless experience significant challenges, discrimination, and stigma. The main issues for me on a daily basis are social and sensory. So I now have, pretty good interpersonal skills mostly, but it's cognitive, it's not intuitive, and that can be exhausting. And some of the issues that we face are qualitatively similar to those who might be much more visibly autistic, particularly around sensory challenges. So I can be very sensitive to lights and to noise. So the first picture is how an office usually looks, but the other one is how it can look on a high stress or a bad lights day. And days like that are really tough. And excuse me, while lots of autistic doctors are managing well, particularly those of us who've made it through the training years and found a nice square hole to fit ourselves into, the recurrent narrative amongst autistic doctors known to me is one of personal distress, professional difficulties, and often a truncated career. Early retirement is common, and indeed after my career break, that was probably expected of me too among some of my clinical colleagues. But the consequences of misdiagnosis are not just career related. Up to 80% of autistic adults have at least one co-occurring mental health condition. Our mortality is 2.5 times the general population rate. Suicide is an autistic crisis, and it's a huge issue for us in medicine, particularly anaesthetists. From the literature, we know that 2/3 of autistic adults have considered suicide, and 1/3 have attempted. 15% of those hospitalised after attempted suicide have a diagnosis of autism, and preliminary data from a psychological autopsy study shows that 11% of those who have died by suicide had evidence of autism. I know, although I don't have the data, I know that there's crossover between physician suicide and autism. And therefore, we need to specifically consider the possibility of autism as an underlying condition in every doctor who presents in difficulty, because it masquerades as anxiety, depression, bipolar disorder, OCD, eating disorder, substance abuse, personality disorders, and particularly note borderline personality disorder, as it's the most common misdiagnosis for autistic women in particular. Also, neurodevelopmental conditions often don't come alone, so there's often co-occurring conditions, ADHD, dyspraxia, and dyslexia. So my belief is that autistic spectrum conditions should be added to the differential diagnosis when any of these present. And it's vital that we accelerate the move towards a strengths-based approach to autism and just resist that tragedy narrative that is so pervasive across healthcare. Moving on to some of my own work in this area. This is a survey looking at the experiences of autistic adults accessing mental health services using a mixed method approach. And we conducted a survey at Autscape, which is a residential conference organised by and for autistic people held annually in the UK, and we received 101 responses. And while qualitative data is awaiting formal thematic analysis, here I have some of the preliminary quantitative data. So we had 18% attending a psychiatrist at the time of completion, 61% having attended in the past, and 43% describing difficulty attending. And I'll be honest, this project is moving a lot slower really than I had hoped, because it's just so painful to work on. I mean, the suicide data in particular is frightening. How have we reached a situation where we as a community are so marginalised and so misunderstood that 86% of us have felt that life is not worth living? 47% had attempted suicide at some point. 65% had engaged in self-harm, which is not something that's widely associated with autism amongst healthcare providers. For 21%, this required medical attention. And I know a few of my colleagues treating patients following an episode of self-harm would think of autism. 27% had been psychiatric inpatients, 11% detained under the mental health legislation, with 10% experiencing restraint. 28% said they used alcohol specifically to manage mental health issues, with 11% using illicit drugs. And this is the poster about the project presented recently at the Autism Research Conference INSAR, which gives a little more detail, although you probably can't see much, but you can access the poster on my Twitter, where it has all the sections in a thread, or indeed email me for a copy. But it gives a bit more detail, particularly where autistic adults turn to for help when in mental health crisis. And it's really striking the number who would not seek help from psychiatrists, from mental health services, or from emergency services. So we expect the ongoing qualitative analysis will shine some lights on the reason for this. But looking now more specifically at women and girls, autism presents differently in women. It's not that long ago that it was thought to be almost exclusively a male condition. The most recent data for autistic women and girls shows a ratio of about 3:1 male to female. Personally, I think it's closer to parity. We are missed and we are misdiagnosed. The female autism phenotype has been the subject of a lot of research, and it can be a controversial topic, but mostly the key point is that we don't fit the stereotypes. The diagnostic instruments have been developed and validated with men, and generally cis white men and boys too, which partly explains why diagnostic rates are also so low in people of colour. Our special interests are more socially based, and there is evidence that women and girls are better at masking and camouflaging, but this has a terribly high cost, with evidence that suicide rates are up to 13 times the general population rate for autistic women without intellectual disability. 3/4 of our group identify as women. Most group members feel that their mental health has improved since joining us, with many describing a sense of finally belonging, often for the first time within medicine. We've developed deep friendships, helped struggling doctors manage challenges at work, and supported others through career changes. We've advocated for those members suffering discrimination and misunderstanding, and been there for those going through acute crises. We have links with NHS practitioner health, and several doctors presenting to their service have been identified and referred for assessment and then on to us for support. So if this feels relevant to yourself or potentially for a colleague, the next question is when to consider an autism assessment. And these really are probably the most relevant questions. Do you struggle with chit chat, small talk, struggle to interpret or anticipate other people's intentions? Do you get totally absorbed in activities and then have difficulty when interrupted? Do you tend to fidget or doodle a lot? Do you always do things the same way? Depend on routine? You're bothered by noise, bright lights, smells, certain fabrics? And then the key question, do you remember feeling different as a child? It's important to understand that autism is not what you may think it is. It's not just the stereotypes. It does not mean we lack empathy. It does not mean we're unlikable or worthless. It does not mean we're deficient. But it does mean that we're different. Being autistic is a different way of being in this world, of experiencing this world, and of communicating and interacting with other people. If you're not autistic, you'll struggle to understand that. And that's a concept termed the double empathy problem, which is developed by autistic academic Dr. Damien Milton. And it's worth looking up if you're not familiar with it. The myth that autistic people lack empathy is probably the most damaging myth of all. The assumption is that we don't feel empathy, sometimes that we don't even feel at all. Look at that bottom left corner, nothing, just like a rock. Whereas the reality is not only do we feel empathy, but many of us are hyper-empathic, often to the point where emotion is overwhelming. We may show empathy differently to non-autistic people. That doesn't mean we don't feel it. And given that the capacity for empathy is associated with our very humanity, this myth has led to the dehumanization of autistic people throughout history. So understanding this point is vital. It's so important that we reframe our view of autism so that we can genuinely appreciate the humanity of our autistic colleagues, our family members, and even our autistic selves. Autism is not a mental illness. We remain autistic even when we're well, and we can be well. Co-occurring mental health conditions can be treated. It is a recognized disability, which gives access to work and reasonable accommodations and support services. Unknown and unmet needs can be best addressed by an autism competent occupational therapist. It's certainly not a barrier to practice. There's no requirement to inform the GMC or other regulatory bodies. And indeed, for some of us, we may be even more likely to retain a license to practice with a diagnosis. Some of you may recognize Dr. Temple Grandin, at one time the most famous autistic advocate worldwide, who says, "The world needs all kinds of minds." I'll paraphrase that and say medicine needs all kinds of minds. Because from an evolutionary perspective, we really do not want to be trying to edit autism out of the gene pool or out of medicine. Because remember, the innovators of science, the pioneers of medicine, those so obsessed with conditions, they tried remedies on themselves. I'm quite sure there were certainly autistic scientists involved in developing the COVID vaccines. Now, I'm not saying that every autistic doctor is an innovative genius, not at all, but I am saying lots of innovative geniuses were and are autistic. So we need to challenge the stigma and the unconscious bias around autism that is so pervasive in society, but particularly in medicine and academia. I personally know many doctors, including several consultant psychiatrists, who know they're autistic, but who don't feel able to disclose or won't even join the private group because of the fear of the impact if it was known. Think back to my earlier suggestion that you may be autistic. How did that feel? Think carefully about feelings around this, because if you're uneasy, please take time to explore that, because that shows the power of the stigma and the unconscious bias and the ableism that autistic people face every day. And this matters because we know the cost of masking, the impact of lost careers, lost well-being, lost lives. I believe that much of the poor mental health outcomes for autistic people, including our 9-fold increased suicide rate, is down to that pathology paradigm which considers autism as something bad, something broken. Can you imagine getting the message since your earliest days that you are, at your core, somehow wrong and need to be fixed? And again, I'm not for a moment denying the serious disability associated with autism or the heterogeneity in presentation, but the way in which autism is framed has a profound effect on outcome. The autistic adults and kids who I know who are doing well, who are content and confident, are those who are either accepted and support childhood or who've put enormous work into overcoming the harmful effects of ableism and stigma. We need to address our institutional culture so it's safe to disclose, because if we want to be seen as equals, we need first to be seen. And far too many autistic colleagues are struggling, trying to pretend we're not autistic without any of the supports which would make life so much easier. Because the benefit of diagnosis is enormous. We realize that we're not broken versions of normal and that we are, to quote Temple Grandin, different, not less. Self-awareness is key. Knowing my challenges were due to autism meant I could learn to manage them effectively. High-achieving autistic doctors commonly mask difficulties up to the point of catastrophic decompensation, which can come seemingly out of the blue. But with awareness of the specific challenges arising from autism, in my view, many of us can be supported and retained or returned to practice. So if you're lucky, you might have someone say, "Doctor, I think I might be autistic." There's a good chance they're right. There are some useful screening tools, and I particularly like the RITFO-RADS for those of us who have managed to learn to mask our autistic traits. But beware, autistic women, even with these, are still commonly missed. On the other hand, if you think a colleague is autistic, let's reframe that. Or again, my colleague is left-handed. You just deal with it. You order some left-handed kit. We need to change the way we think of difference. We need to stop using the term as an insult or as a synonym for an unpopular or difficult colleagues. We need to consider communication, predictability, sensory needs. We need to focus on the strengths and mitigate the challenges. We need to deliberately and actively promote inclusion. I'll skip most of this except to say that the GMC Fair to Refer report looks at differential referral rates and highlights the challenges for some groups of doctors who are seen as outsiders. In contrast, the GMC Welcomed and Valued report states that a diverse population is better served by a diverse workforce. Being autistic can seem like a parallel universe at times, and for most of us, feeling so different, even as children, sometimes to the point of wondering if we were aliens, is a common experience. And that's a key question for anyone wondering if this fits. Did you feel different to your peers, even as a child? Don't assume that you understand autism unless you really do, because it's easy to recognize once you know it, but medical training generally doesn't prepare us, and often our concept is based on stereotypes or what limited exposure we've had. And while understanding of autism is increasing, it can still be challenging to find specialist advice. So in summary, please consider autism, resist that tragedy narrative, and remember that we make good doctors. We'll continue to raise awareness through various upcoming publications, research and advocacy projects. We've recently given a workshop on supporting autistic doctors at the recent International Conference for Physician Health. We'll have presentations and posters at the upcoming Royal College of Psychiatrists International Congress and the Royal College of General Practice Conference as well. For anybody who'd like to join the group or feels that the group would be an appropriate place for them to be, you can find us on Facebook, send a message via the public page, or of course you can find me on Twitter, or indeed feel free to email me directly. Okay, so you'll get the slides, which will have some links for further reading. So I'll leave it at that for now, and I'm happy to take some questions if there are any.
Thank you so much, Mary. That was such an amazing talk. And we've got so many lovely messages in the chat, as well as some questions as well. So I'll just start by asking one I got sent, so it could be anonymous if that's all right. So how would you recommend seeking a professional opinion if they think they might be on the spectrum?
Yeah, that unfortunately, it's a bit of a postcode lottery at the moment. Certain areas have services that are much better developed than others. Generally, there's two options. One is either through the public services, and the access route would be via your GP, or alternatively a private, private assessment. Here in Ireland, we have practically no access to adult diagnosis in the public service, so we really have no option but to go privately in Ireland as autistic adults. And in ADI, we have links with a service that, excuse me, that provides an online assessment and diagnostic service for both Ireland and the UK. And they've assessed quite a few of our members, so they do have an experience with, with autistic doctors. So that's generally what we use. But again, it depends where you're based. I'm not really able to see whether, are there any other questions? I'm not sure what I've done with the chat box, I'm afraid.
Sorry, I was on mute. I was okay. I just realized I was reading a question and I was muted. So Kezia asked, there's interesting the connection between autism and BPD, especially considering the gender differences. Women are more likely to be diagnosed with BPD, and I wonder how much of that is autistic women learning how to mask better.
Yeah, it's a
quote
lot.
unquote better.
Yeah, it's absolutely a lot. I mean, back 10 years ago, there was practically no awareness of this issue. But over the last few years, that awareness really has been growing. Thanks to a few really key psychiatrists who've pushed that message within the world of psychiatry. And yeah, a lot of women who are diagnosed with BPD or EUPD are definitely autistic. I know so many autistic women who have had a previous diagnosis of borderline personality disorder, and it really matters because the management is totally different. I know so many women who have had significant involvement with mental health services, significant mental illness, mental distress, and only really be able to find a route out of that once an accurate autism diagnosis was made. Unfortunately, there is a sort of an old idea, which I hope is changing, but maybe not as fast as we might like, which is that, well, even if a woman is probably autistic, it's better to give a BPD diagnosis because at least we can do something for that. We can't do anything for autism. That is so damaging. It's still a pervasive attitude, I'm afraid, among, but it is so damaging because it's not true. It's absolutely not true. So yeah, women, to the point where I think every woman with a BPD diagnosis should at least should be either screened for autism or at least have it considered for sure.
Yeah, thank you. I'll just move on to the next question. Oh, I just want to read some of the comments for you that are really lovely in the chat. So someone's put, just wanted to say that as a diagnosed autistic, I really appreciate this, particularly pointing out that we are taught we are defective and in many ways continue to be seen that way in the world.
Yeah.
Someone else put, really enjoyed this talk. Autism is beautiful. Thank you. Next question we have is, if you had unlimited resources, how would you go about changing society to be more inclusive?
Oh, that's got to start really early. It's got to start with the kids, I think, really. And there's a fabulous project that is underway in the UK. I think it's in Scotland. I'm not sure if it's Edinburgh. It's the Leans project. It's don't remember exactly what it's learning about neurodiversity in schools, at primary school. And it's a project that gives me so much hope, because when you get kids before they've learned to discriminate, before they've learned to marginalize difference, that's where you will really where you will really have an impact. I think there's a huge need for autistic led training for healthcare professionals, and I think there's a huge need for autistic led courses and training for parents, particularly parents who are new to the world of autism and neurodivergence, because so much of what is taught, it's taught from a neuronormative perspective. It's taught by neurotypical people or non-autistic people, and you know, a lot of it is wrong. So I change all of that.
I definitely agree with what you said about the neurotypical people teaching things. I think that I've got ADHD, I don't have autism, but some of the advice I've been given since my diagnosis has just been all things that would never work for someone with an ADHD brain. So yeah, exactly. I completely get how having people with ADHD or autism or any form of neurodivergence would be good. Okay. I'll just quickly look for another question. My friend's third year research project was on literal interpretations, possible autistic sitcom characters, and a little on stigma. And there has been so little research on stigma and such related to autism, especially in specific populations, e.g. healthcare workers. What do you think can be done to encourage this research?
Oh, there's fabulous work happening on stigma at the moment. This year has just been incredible, and it is so encouraging to see. There's a researcher called Dr. Monique Botha-Kite, who specifically looks at stigma and mental health in the autistic population. And there was a panel on stigma at INSAR this year. Now that's the International Association for Autism Research, and that's not a social sciences based conference, that's the biological sciences. So that's all the people who are, trying to cure us and, figure out what is wrong with us. But they actually included a panel on stigma this year.
Wow.
And that's been led by the community, led by the autistic community. It's been led by autistic researchers standing up and declaring, I'm autistic, and driving research in a way that really matters to the autistic community. So there is really exciting things happening around that area at the moment. And as I mentioned earlier, we have a letter due to be published in the Australian Journal of General Practice. And I think, to my knowledge, that's the first sort of publication that will link the use of language, because so much of the language is stigmatizing and dehumanizing. I mean, honestly, you should read what is written about us in so much of the research literature. But that letter will link the use of non-stigmatizing language and mental health outcomes. So I'm looking forward to that. And we have other work in progress. There are other research projects that are that are underway, looking specifically at that, because my personal view is that the stigma associated with autism is such a huge driver of our mental health outcomes. So it's most definitely the thing we most urgently need to address.
Yeah, thank you. We've got another question that's just been popped in the chat. What are your opinions about the portrayal of autism in films and TV? Are there any accurate portrayals, or do you think it can sometimes portray autism in a stereotypical way that does not truly represent the broad nature of autism?
Oh yeah, totally. I mean, some of them are just so awful. But then we have to remember as well that behind every stereotype there is an element of truth. And when you're looking at the autistic population, it's just so important to remember just how different we all are from each other. You know, well-known autistic academic Dr. Stephen Shore is well known for saying, you know, when you've met one autistic person, you've met one autistic person. You know, and that's so true. But like, some of them are just so awful. They really are. But then again, some of them are fine. Some of them are, you know, I mean, I like The Good Doctor. You know, I think some of it is absolutely awful. But at the same time, if some of it, like particularly when he's having real challenges, they just resonate really deeply. I don't know if anyone watches it or remembers the particular episode where he couldn't find his screwdriver, you know, and had a huge meltdown over the screwdriver. And I remember feeling that. And it's just, for me, it's this dichotomy between experiencing and existing in that space and also having to be professional in my career and just never letting those, you know, cross over. And it's quite a challenge. But no, I do. I usually enjoy, I do usually enjoy fictional portrayal of autistic people, regardless of how awful it is at times.
Yeah, so I'm sure some of them, yeah, aren't great, but yeah, I'm glad you enjoy some of them anyway. Lovely. I don't think we have any more questions in the chat. If anyone wants to pop any in, feel free to do so quickly. I have a question for you, if that's all right.
Sure.
I'd love to ask how you sort of managed your late diagnosis in life and how that was for you.
Gosh, it was tough, I'll be honest. Now, at the time I was diagnosed, things were very difficult for a number of reasons. And I think one piece of advice I was given was to just take some time to process it. You know, and to take up to 2 years to process that diagnosis. And in fairness, for me, that was very, very accurate. I did need that time. And that was a bit of a roller coaster, but I'll be honest, 2 years out, I was good. You know, almost to the week, I think. 2 years later, we're in a good place with this. Do I wish, I often get asked, do I wish I'd been diagnosed earlier? And I have a very mixed view on that. On one level, yeah, sure, because there was some times that things were just, oh, it would have been so much easier if I knew what was going on, what the issues were. But at the same time, I'm also quite conscious that if I had been diagnosed earlier, it's quite likely I wouldn't be a doctor. Yeah. So I need to be very careful about lowering our expectations for our autistic children and young people, because sometimes, while it's wonderful that kids are being recognized, you know, we do also need to help kids to reach their potential.
Yeah, thank you so much. One last question we've got in the chat. Can you recommend anything for learning facial expressions, etc. as an adult? A lot of the material is aimed at children.
No. Why would you want to, is my view to that one. I think it's much easier to explain to people, I'm autistic and therefore I don't communicate in the way you might expect. I think that because, you know, that's very much no, that's there is a level of sort of communication and kind of conventional communication that we need to learn, particularly those of us in healthcare, obviously. But at the same time, we also need to think about autism and being autistic and the way we communicate as autistic people as almost akin to a different language, almost like a different culture. Well, actually, yeah, just like a different culture. And the thing is, like, lots of those of us in healthcare, we work with international colleagues, and we're used to just accepting that people from different cultures will use English in a different way. So if if I'm listening to an Italian colleague presenting and, they're spelling mistakes, grammar mistakes, we just ignore that and we move on and we get the message in a way that we wouldn't if it was an English-speaking person making the same mistakes. And I think we just need to move to a situation where we have the same approach to autistic people, because it can be quite dangerous to try and emulate autistic people because we often don't get it right. And pain, for example, expressing pain, now that's a whole other talk. But in terms of autistic people don't express pain the same way that non-autistic people do. And so that can lead to undertreatment of painful conditions, but it can be made worse when autistic people who know about this issue then try to perform their pain. And that can lead to a real cognitive dissonance. So I'm certainly not in favor of teaching autistic kids to mask. Absolutely not. I think that is probably one of the most damaging things that we can do to our autistic kids. Now, obviously, if autistic adults choose, and want to learn, conventional social skills for themselves. I took it on as a project years ago. I was almost like an anthropologist in terms of learning about this. So I've got bookshelves of, communication skills and body language and all that sort of thing. But it's like learning a different language. And so long as it's not done in a way that the non-autistic way of communicating is held up as the bar to which we must reach, then it's okay.
Amazing.
Not sure about the question.
No, it does. I think you answered that beautifully. Thank you so much.